Mr. Miller.
Thank you, Mr. Chairman, and the witnesses for testifying here today. Ohio families, individuals, and small business continue to struggle with the high cost of health care, as climbing premiums, significant deductibles, and denial of necessary treatments are taking a serious toll. The United States, including the world-class medical facilities in my home state of Ohio, is leading the way in the state-of-the-art medical advancements, many made possible through federal funding. However, for many people suffering from life-threatening diseases, these breakthroughs remain out of reach. According to the Health Policy Institute of Ohio, more than 1 in 5 Ohioans have trouble paying medical bills as healthcare costs are rising and out-of-pocket costs are significant, even for Ohioans who are insured. It has also been reported that nearly 1 in 3 people living in my state have avoided a doctor-recommended procedure, lab test, or evaluation in the past year because they simply couldn't afford it. As this committee has highlighted, the costs to our nation's healthcare system are exacerbated when chronic illness disease develops compounding expenses for providers, insurance carriers, and the federal government. But beyond these financial burdens, the cost to human life is immeasurable, and we're seeing that here today. In my district, a young girl with autism was told she could not access treatment for over a year for a serious dental issue, impacting her overall health. For far too many people, affordability is a key factor in whether they can survive cancer, heart disease, and other chronic illnesses. As echoed by my Health Advisory Council, Ohioans battling cancer facing cost barriers are more likely to have their cancer diagnosed and treated at an advanced stage when survival is less likely, and the cost of care is more expensive. Also concerning are insurance practices that outright deny coverage or charge exorbitant rates to the elderly, just because they have serious medical diseases when trying to re-enter through the Medigap policies that we've seen. The lack of affordable care for consumers also echoes through the entire healthcare system, with Metro Health in my congressional district losing $1 million a day and the Cleveland Clinic providing aid to patients unable to afford care. In an effort to lower costs, University Hospitals is taking strides through Medicare shared savings while improving quality. Rising costs hit hospitals, physicians, and emergency rooms. Then ultimately the federal government picks up the tab through state-directed payments and other means of addressing uncompensated care. This is simply unsustainable, as pretty much every member has said this today. Finally, coverage denials and prior authorization requirements, as echoed by everyone, from small independent practices to large hospitals in my district, place significant burdens on the entire healthcare system. A local OBGYN was forced to close her doors despite patient need. In addition, more efficient prior authorization practices must be aligned to lower overall patient costs without compromising reimbursements for critical treatments. In the end, such delays jeopardize patient care. As such, I seek the witnesses' commitment to work with me to resolve these issues impacting my congressional district. We can and we must do more to address these rising healthcare barriers within our nation. I appreciate everyone being here, and I know it's been a long day, and it's been told you probably a dozen times, and it has for everybody, but I'll try to keep things short. A few weeks ago in Congress, we had a pretty tough vote. I took that vote. I took that vote to keep my constituents covered. And the way I look at it now is that it's time for all of you to start making some tough choices. I want to know, yes or no, do any of you believe that inefficient prior authorizations improve affordability for the American people? Mr. Hemsley, yes or no?
Inefficient ones, no.
Mr. Joyner?
No, we have a lot of work to do between us and the providers.
We can do better by connecting directly with data.
Thank you, Ms. Pedro.
No, and we've made public commitments to drive improvements, and we're ahead of schedule on those commitments today.
Ms. Margaret?
No, and we're working on it as well.
Thank you. Now that we've established that inefficient prior authorizations make healthcare unaffordable, I'd like to get your commitments that what you'll do to address this problem will not get passed on to patients, because I believe that continues to happen. Can everyone commit to not passing those costs on to patients?
We, as indicated, we are really driving a real-time, straight-through prior authorization agenda and have that in market So we don't expect these costs to sustain. We expect to be on a vastly more efficient system. Those are in the marketplace right now, and they're being experienced by care providers.
Well, Mr. Adams, I can just say very quick, I know I'm out of time, but what I'm hearing from my own constituents, and what I'm hearing from 3 major hospital systems, and what I believe is the largest, not only within the country, but the entire world, is that prior authorizations are making it almost impossible to do their job and to take care. Why? It's because they have to rule everything out. Even myself, when I had to go in for a simple procedure, had to go through 6 months, then I had to get a laminectomy for my back, and I had a severed nerve, and I could no longer feel the feeling in my leg. I mean, it is out of control. I think that this is absolutely insane, and we'll be following up, and more so, I really, at this point, I will yield back, but I want to know how much money, everyone is making off of this in prior authorization. I know you say you're saving money. I would actually like to see that data and how much, because the reimbursement, I believe, and what we have seen, is staying in your bank accounts, collecting interest that stays longer than it usually should. But with that, I yield back.
Mr. Marine.